Mr. Dickens is a very unusual case. He presented to us on the verge of death. He basically had a valve that he had implanted 15 years prior, and that has embolized, what we call embolized, flown away from where it's supposed to be in the heart.
I was at my neighbor's house, and I felt like a thud in my chest. I was like, what is this? And I go home, I told my wife I felt bad. I told her she needed to call the ambulance. I called the ambulance, and it turned out my mechanical valve fell inside my heart.
And lodged somewhere else distal to the aorta. And the heart was failing because of loss of function of this valve, and then the valve itself was causing problems elsewhere. He was only alive because of all the maximum support he was on at the time. Fortunately, he's now back to work, and he is doing great.
If not for his team, Dr. Bedeir and his team at Mobile Infirmary, like I said, I wouldn't be here, because it was a shock to me and a shock to my family. And then I'm just so grateful for him for bringing me through this and getting my health back in line where I can be with my family. And I didn't die, so obviously I didn't die, but if not for them, I probably would have.
This is a very unusual case where it's not in the textbook. It's not something you get trained for, but I'm very grateful for all the training that I've received, and it makes you ready to think out of the box and deal with what you're faced with. And we have a great team. We came up with a plan, acted fast, and he was fortunate to do very well.
I'm able to live life the way I did before.
In retrospect, looking into all the literature and everything published, over the 60 years that we have been doing heart valve surgery on people, only 3 people survived this, and Mr. Dickens is one of them. We're fortunate to be part of this.